I'm just going to kick us off and then I'm going to pass it over to Karen shortly. So, when Phyllis first approached us, she said she wanted some information on the changes to Medicare and with a focus on prescription drug plans. So, our title is the 2025 Medicare Updates and Prescription Drug Plans. And right now, it's open enrollment for people to make changes to their Medicare plans if they like. So next, that will go up until December as well. Okay. So we work with the Department of Family and Support Services for the City of Chicago. There are several divisions, 7 divisions for the DFSS, and we are the area agency on aging for the Chicago area. There are 13 area agencies in the state of Illinois, and so we represent all of the city. Uh, then there's another area that represents the rest of Cook County. That would be Region 13. So we are the ones tasked with doing all of the advocating for older adults, planning and coordinating services throughout the city that will focus on helping older adults, particularly those in greatest need, especially social or economic need. We try and focus on people who don't have other supports that may be living alone or at risk for institutional placement. And the best way to reach the area agency is to call 311 and ask for senior services, or you can call directly at 312 744 4016. Next. Okay. So, just to give you a better feel for the types of services we do, and I don't want to belabor this too much because we do want to get to the meat of it, and we'll be more than happy to answer any of your questions later in the program about our services. But we're also looking to share this information with you again in the winter. So, we provide an information and assistance line. If you have any questions about services for seniors, need to know whether it's something the city provides or another agency, we can usually assist there with the INA information assistance line. We also provide some help with in home support services like home delivered meals, short term chore if somebody needs to go in the hospital, let's say, and then it, the heavy duty chore program is when somebody has um, big cleaning projects that they can't do on their own. It may be like their spring cleaning. We also offer a whole portfolio of caregiver programs, legal services, and then we have the Adult Protective Service Program, and we make referrals to the state for that as well, and the Ombudsman Program. We have special outreach to grandparents who are raising grandchildren or other relatives. And it usually is a relative that the person who's doing the raising would be, so that you don't have a situation. It doesn't have to be a grandparent, it could be a great aunt, but it's to help people that are taking care of the younger generation and raising them up. And then we do volunteer and social isolation programs, particularly our volunteers with the foster grandparents and the senior companion volunteer program. And then we have things to assist families with caring for people with dementia. And that would be caregiver education programs like Savvy Caregiver, stress busting, and some training for professionals, apartment managers, particularly. And then, of course, what most people know is our uh, senior centers throughout the city. And that's where people can get congregate meals and also a lot of activities that go on. And fairly recently, we've been doing the online senior center through our Senior Connected brochure. Okay, I believe, what would be the next one, Karen? Am I passing? Yeah, I'm passing it over to you right now.
Sure, sure. I'm happy to take it. One thing, hello, everyone. I'm so glad you're here today on maybe not the most exciting topic in aging right now, but definitely one that is very timely. Show of hands or some nods on camera. Who has received a piece of mail about Medicare in the last few weeks? Yep. How about, have you seen a commercial? Have you maybe gotten a phone call? A lot of people are telling me they're getting phone calls that are unsolicited and they want to know, how do they stop? And that is because it is Medicare open enrollment session right now, as Victoria said. And so it's the time of year when you can make all of these changes. And so Medicare changes every year. There's small, modest changes. However, this year, and since actually 2022 during COVID, we might not remember it, but there was pretty significant legislation that was passed in Congress that is coming really into fruition. And so there's some really important changes we want to know about. Now, I know particularly y'all had said you wanted to know about the Part D plan, but the changes actually are impacting other areas as well. And so we wanted to just make sure that we covered all of that so you know the broad variety of things that are coming your way. Now, my understanding from Victoria is that you all actually had a Medicare kind of primer or an overview last month. Is that correct? Was everyone there? Most people were there. So this presentation is not designed to tell you everything about Medicare, because we could spend at least 2 hours on that alone. So really just a couple slides to kind of orient everyone, or if anybody missed it. And we haven't talked about SHIP yet. Our senior health insurance program is a wonderful program where people get trained about Medicare and they become volunteers for the Medicare program. And it's a rigorous program where you learn all about the ins and outs and the nuances of Medicare. And I'm delighted to say that Lori Rubin, one of our SHIP volunteers with the city of Chicago, has joined us. Lori, I see your head there. Do you want to wave to everyone? She actually is in your neighborhood, and I asked her to join us today. So we're really delighted to have her with us as well. Okay, let's jump in. I'm going to ask that any questions you have, you can go ahead and put in the chat. If there's specific questions about your individual Medicare situation, we can talk about kind of general things, but individual Medicare situations are often left to a one-on-one consultation, because if you've seen one person's Medicare plan, you've seen one person's Medicare plan. I'll sometimes hear spouses or partners or friends say, oh, well, my best friend has the Blue Cross Blue Shield Medigap plan, so I got that. Or she has the Humana coverage, so I got that because she says it's the best. And while certainly it's always wonderful to share your personal experience and views on your plan, I just really want to caution you about automatically accepting what is good for someone else, because we all have such different situations in our lives. So we all have different histories. We all have different medical conditions and medical histories. We all have different resources. Some of us may, in fact, be have pensions that are paying for part of our Medicare plan. And so we're in a certain structure. And so we need to work within that structure. Others of us can choose whatever we want. And so because all of those things are so variable, it's really important to do some research on your own and find out what is most relevant, affordable, and fits the level of risk or tolerance that you might have. So I'm glad y'all are here, but my take-home message is going to be, we have additional support both through City of Chicago staff, our SHIP counselors on staff here, and then we have volunteer SHIP counselors out in the field. And I will tell you also, kind of a spoiler alert, I'm going to, if you find this really interesting and it's something you'd like to know more about, and Medicare is something that you think you could wrap your head around, we have an opportunity for you also to become a volunteer. So we'll come to that later. But let's go ahead and just dive into Medicare quick 101. So original Medicare Part A is your hospital insurance, and that is the Medicare that everyone gets. Now, does everyone get that? Not necessarily. Everyone who gets it is actually people who have worked 40 quarters. So 10 years of work history are required to pay into Medicare Part A. So in order to really get into that program, you have to have worked a certain amount of work, or Regan, I'm going to let you know. I'm sorry. I've been kind of letting people into the waiting room. I don't know if you see there's, I think, a couple of people in there. So you either need to work those quarters, or there's a tiered plan where you can buy into Medicare. But everybody gets Medicare Part A. Medicare Part B, of course, is the part that you pay for. That covers things like your doctor's visits, emergency room, ambulance services, medical supplies, home health, and other health-related expenses. That is typically taken out of people's Social Security check, and everybody pays for that. And I know most of you are already on Medicare, but just a word of caution, if you have loved ones or friends or family that you are going to remind them to sign up for Medicare during that 3-month window that they have. For Part B, they either need to be working and using their work insurance, or they have to sign up for Medicare Part B within 3 months. And I just always want to tell people that, because if you miss your window to sign up for Part B, you can pay a fine, basically, that'll be tagged on as a late fee every single month for the rest of your life. So I always caution people about that, about Part B. Part D, of course, is our prescription drug plans. And keep in mind, those can be either standalone plans or Medicare encapsulated or included in a Medicare Advantage plan, which is either Medicare HMO, or sometimes they have Medicare PPO Advantage plans. And those may or may not have prescription drug coverage. So you've got A, B, D. I will warn you also that if you need to sign up for Medicare Part D, again, you can use your drug coverage through your employer if you're still working, if they have more than, I think it's 50 employees. However, if you are not still working, you do need to choose your D plan right away. So a lot of people get tripped up with Part D because they say, I don't take any meds. Why do I need to take a Medicare Part D plan? I don't need that. Or I'm very healthy. Why do I need Medicare Part B? And they end up paying fines. We don't want anyone to pay fines, so I want to just make sure you know that. Okay, next, something else that's really important to know, and this changed a number of years ago, but it keeps increasing. There are, in Medicare Part B, there are significant prevention and wellness benefits. Every year you can get a wellness visit. When you start Medicare, you get a welcome to Medicare visit. But really importantly and significantly, almost all of these are at free or low to no cost, and include things like it's Breast Cancer Awareness Month. It was, and so now mammograms are included, other cancer screenings, depression screening, diabetes. These are all really important and available at no cost. Of course, you may have noticed I missed a letter. Medicare Part C, these are also known as Medicare Advantage plans. These are bundled services. So I'll show you a little chart in a little bit, but you either have Part A and B, or you have Part C. And so Part C offers a bundled service provision at different costs, and often includes your Medicare, your medication cost. They may have a lower out-of-pocket cost or monthly cost than original Medicare. However, the limitation that many people find is that you need to use all of the in-network providers. And so if you've been going, to example, for Northwestern for your entire life, you have physicians you really like, sometimes they're not covered. And so many people prefer to stay with their physicians. And so that's something important to consider. Also important to consider is the fact that physicians will oftentimes leave the group. You'll also have to go to separate skilled nursing facilities. And in addition to that, may have to use other providers that are within network. However, Part C plans are often appealing to people because they may offer things like vision, hearing, or dental. And you really want to take a look at what is covered by those, because, for example, it may be that your dental coverage is one cleaning a year, and that's it. And so you really want to carefully consider what is offered and what your individual needs are. Going back to that idea, if you've seen one Medicare plan, you've seen one person's Medicare plan. Now, Medicare Part D, we're going to spend a lot of time on today. This is our prescription drug coverage, also called, you'll hear PDP, that stands for Prescription Drug Plan. But this started at about almost 20 years ago, I guess. And really, these are very individualized. And I know that this is something where there's significant cost savings from plan to plan based on the plan you choose, the monthly cost, but certainly, and also the type of medications that you take. Now, we know that people can have a new medication prescribed every time you go to the doctor. And so you'll be glad to know that there's some changes in how frequently you can change plans. Okay, going to the next slide. Medicare drug coverage pays for all the drugs you need. As I said earlier, you should get your drug plan now. If you don't take any medications, you can certainly find a plan that is no deductible and no monthly cost. So keep in mind, you can meet the needs or the requirements of the program and still get what you need. All right, let's carry on. So here's just, I like to see things visually sometimes. So I'll be doing a lot of talking today. And so I'm trying to include some other visuals that help to understand. So you can see kind of determine how you want to get your coverage, or for some people, it's what's covered from my pension. For others, it might be what is least expensive. So you need to find your orientation. And so you want to consider what the cost is of Part B. And if you get Part A and or Part B, you will want to then, of course, decide on a drug coverage plan. After Part D, you will want to decide about a supplemental coverage. These are called Medigap policies. Everybody by now should have gotten a booklet in the mail called Medicare and You, maybe an inch thick with all of the plans listed in it. I see some nods there. That has all of the details about the plans. And so you can look through that to see the different Medigap plans. Sometimes you want to be careful about ending a Medigap plan if you've been in it for a long time, because some of them they're not offered anymore and you're grandfathered in. So always you want to be very careful and intentional when you're making changes. So you can see on the right-hand side, though, if you get Medicare Advantage, You just need to sign up for Medicare Advantage and then decide if your plan covers drug coverage or not. And if you have Medicare Advantage, you cannot be sold a Medigap policy. And remember, Medigap policies, they can be expensive. They can be, usually I've seen them anywhere from a couple thousand to maybe up to $4,000 a year, depending upon your health issues and your history with the company. However, what they do is they cover your copays, your co-insurance, and then they also cover many additional days, for example, in skilled nursing. So they really increase what you can get for free because you paid for it on the front end. So please consider those as well. All right. Well, how did we get to where we are today? So the Inflation Reduction Act, which, as I said, was passed during COVID, that was a big deal for Medicare. And it was the first time that we were allowed to negotiate with drug manufacturers for the price of some Part D and Part B drugs, which will start in 2026. I have a list of them that are in the first grouping. I'll show you that later. But the ability to negotiate in Medicare is a really important step forward for us. And so what this also did is starting in 2025, this year, January 1st, Medicare out-of-pocket prices are going to be capped for Part D at $2,000. Now, remember, we had that weird thing called the donut hole for the last 15, 20 years, where you would pay a certain amount and then you'd fall into the coverage gap or the donut hole, and then you would have catastrophic coverage after that. Previously, it was up to $8,000 out of pocket a year. It is now capped at $2,000. So this is a big, big change for Medicare beneficiaries, and one that we're really excited about. Again, every change that you make during open enrollment and every change that we talk about today, unless I assign a year to it in the past, will start in 2025. So also there's the cost spreading opportunity, payment plans this year, which are exciting. I'll get into that later on. In 2024, so this year, the 5% coinsurance for Part D catastrophic coverage was eliminated. Also, the Inflation Reduction Act of 2022 began to put a strong check on the rapid increase that prescription drug company insurers could add to their plan every year, and the increase that they could add to medications. And so that started in 2023, and then the premiums started this year. Insulin, as we know, this has been talked about a lot in the election, but insulin was limited to monthly out-of-pocket copays for $35. That was a game changer for many people with diabetes. Also, in 2023, adult vaccine cost shares were eliminated. And so that's something really important. So now your shingles vaccines, your flu vaccines, your COVID vaccines, your pneumonia vaccines, what once may have been a couple $100 is no copay at all. So that's very important. Again, cost sharing was eliminated on those as well. And then the Part D low income subsidy, which was also called extra help. And I've got a couple slides on that at the end. It raised the threshold that you could have the amount of money that you could have or resources up to 150% of the federal poverty line. So that was a really wonderful change as well. All right, so we talked a little bit about what happened in 2023, the insulin change, again, no deductible there. And then the durable medical equipment that was furnished with that, such as insulin pumps, that was included also mid-year in 2023. And while it's important to remember there's been changes in insulin, that Part D plans still don't have to cover all of the insulin products at the copay level, only those that are on the formulary. So remember, each Medicare Part D plan will have its own formulary or the type of drugs that it covers, the brand names that it covers, and the tiers, and sets the prices that those different groupings of drugs are on. And we talked a bit about Part D. So again, I'm a visual person, so I really like to see timelines. So I think you can probably read this. This is from the wonderful Kaiser Family Foundation. And it just helps you to really see and understand that we've been doing a stepwise progression every year as Medicare Part D is changing. And so we're firmly at the end of 2024, where coinsurance for catastrophic coverage is gone, and we have expanded eligibility for Part D. And then what we have in 2025 is that $2,000 out of pocket cap, and other drug benefit changes. And then in the coming years, 2026 through 2028, what we will see is drugs, some of the most expensive drugs are going to be tiered in groups, and they will have cost negotiated. So the 2026 drugs, I have a chart in a little bit for that, so I'll show you that. We don't know all of them for the future, but we do know the 10 that will be coming in 2026. So another way to look at this is how is this change really happening? You can see that this chart shows us what 2024 looks like compared to 2025. So in 2024, you had your first phase. Before anything else, it was you had to get to your deductible. And then you had cost sharing, where the insured individual would pay 25% and the plan would pay 75%. And your initial coverage limit was $5,000, right? And then you would get to the donut hole, or the coverage gap, where you would have both your applicable drugs and your non-applicable drugs. And you can see the cost sharing for individuals was 25% for both. However, for applicable drugs, the plan only paid 5% and the manufacturers had to kick in a discount. Whereas for the non-applicable drugs, the client or the beneficiary still had to pay the 25%, and then the plan would pay 75%. So remember, we talked about those groupings of drugs in the Medicare Part D plans. This is an example of that. So in 2024, the out-of-pocket threshold that had to be met before you got to catastrophic coverage was $8,000, okay? So after that, the plan would pay 20%, and then reinsurance would pay 80%. And of course, you would pay nothing over $8,000. Moving forward to the right column here into 2025, the deductible people have to pay has gone up by $45. And as you can see from this comparison, the initial coverage limit was eliminated. So during the initial coverage phase, the applicable drugs had still a 25% copay. And there's a split between what the plan pays and the manufacturer, and then what the plan says. No more initial coverage limit, so no more donut hole, and $2,000 is the most that you will ever have to pay. So if you have a drug that you take that may be one of the more expensive drugs, and your copay is $500 a month, you would pay $500 a month for January, February, March, April, and then you would not pay anything for the remainder of the year. There are other ways to stretch those payments out. I'm going to talk about that in a little bit. Here is just a different way that people kind of think about what their coverage benefit is the annual deductible, your initial coverage, and the catastrophic plan. So this is just a different way to kind of say the same thing. However, what this does show is that you can see the extra help addition here. So remember that low income subsidy or extra help, it caps the amount of the, you can see with Medicaid and without. You can see what the price ranges are, and they're really significantly impacted by the extra help plan. So let's go ahead and carry on. So here's an example here. Again, just another way to kind of think about how we're talking about this. Ms. Smith joins a Medicare drug plan. Her coverage, as all coverage, begins January 1. She doesn't have extra help, so she does not have that subsidy, and uses her Medicare drug plan membership card when she buys her prescriptions, and she pays a monthly premium throughout the year. So for her deductible, she would pay that $590 for the drugs before the plan starts to cover its share. And then the manufacturers will provide the 10% discount, and then she would pay a copayment, and her plan pays its share until she hits that $2,000. After that, in the catastrophic coverage plan, the manufacturers provide the 20% discount. And then because the beneficiary won't have any more out-of-pocket costs once that $2,000 is hit. So we talked a little bit about the specialty tiers, and this really only pertains to people that have drugs that they are on with a high deductible for them. So the drug sponsors, the plan sponsors can't charge coinsurance for the specialty tiers that exceeds the thresholds that you see here. And this is by individual drugs. So you would look at what your deductible is, and then that would be the maximum allowable specialty tier coinsurance. So what this chart shows is that the more expensive the drugs, the less expense, or the cap on the specialty tier coinsurance. So as the price descends, the allowable coinsurance increases. If you're on multiple drugs like this can make a big deal. If you're on a high expense drug, this can make a big deal. But again, this is another change that's very important to consider. Another change of the Inflation Reduction Act is, every time you get a Medicare service, that packet you get in the mail, the explanation of benefits, it's usually 5, 15, 20, sometimes more pages long. It sometimes can be very confusing to read. And so as of 2025, the CMS revised the explanation of benefits with the intention, and I hope you say that this is true, that it makes them much easier to read, and they're much more clear, and that really there is a higher coverage to make sure that Medicare is watching carefully to ensure that the materials that drug plans are putting out are really complying with all the new requirements that exist. So in summation, in 2025, another change that is happening is that there is an option to pay out-of-pocket costs as a payment plan in monthly payments instead of all at once at the pharmacy. So remember the individual that I talked about who had a drug that cost $500 a month, and in 2025 they were anticipating paying that drug cost in January, February, March, and April, because they have a $500 a month cost, and it is a $2,000 expense for everyone. that person will be able to say at the pharmacy, I'd like to do a payment plan. And at that time, what happens is the pharmacist will say, okay, they will, excuse me, I'm in a session. They will go ahead and they will not take a payment for you at the pharmacy counter. They will say, okay. And then the plan sponsor bills the participants monthly for any cost sharing that they have while they're in the program. So the pharmacies are then paid in full by the Part D drug sponsor. So instead of the payment coming from you, it comes actually from the sponsor. So again, this is important for people that have a high cost for one of their medications. And I've seen a lot of articles about this. Terry Savage has been writing about this. This is going to be a big change for people. And so this also is a big change because for Medicare drug people who are eligible for extra help, for those beneficiaries, extra help will still be more advantageous than the Medicare prescription drug plan. So here's another illustration of how that works, because it's helpful to see it rolled out through the month. So you can see one anticipated paying $2,000. He knew that the new payment was $2,000 a year. And so he tells the pharmacist when he goes to pick up his first bill, and they use something called the maximum possible payment calculation. And so he's billed $166. Moving forward, a different calculation is used monthly, and you can see that it goes to $75, then $125, and going down further from that until you get to that $2,000 out-of-pocket cost. Now, of course, if you have other drug cost affiliated with this, that will help you reach your $2,000 deductible more quickly. Okay, moving on. Just in the interest, I hope you can hear this. Please can someone give me a thumbs up if you can hear this? This is a well-received info/commercial from Medicare about this. Let's see if y'all can hear it, all right? Oops. Sorry about that. Could you hear the beginning?
An official message from Medicare. If you're like me, you might have a high-cost prescription or two. And when I fill those at the beginning of the year, that means a lot of money coming out of my pocket at the same time. Starting in 2025, there are a couple of changes to help people like us. The prescription drug law caps your out-of-pocket drug costs for covered drugs at $2,000 in 2025. Also, there's the new Medicare prescription payment plan. It's offered by all Medicare drug plans and by Medicare health plans with drug coverage, including Medicare Advantage plans. Here are 5 things I learned about the Medicare prescription payment plan that you should know too. 1, it doesn't cost you anything to participate, and participation is voluntary. 2, this payment option can help you manage your out-of-pocket Medicare Part D drug costs by spreading them across the calendar year. 3, your payments might change every month, so you might not know what your exact bill will be ahead of time. Future payments might increase when you fill a new prescription or refill an existing prescription, because as new out-of-pocket costs get added to your monthly payment, there are fewer months left in the year to spread out your remaining payments. 4, you're most likely to benefit from this payment option if you have high drug costs earlier in the calendar year. You can start participating in this payment option at any time in the year, but starting earlier, like before September, gives you more months to spread out your drug costs. 5, if you use this payment option, each month you'll continue to pay your plan premium if you have one, and you'll get a bill from your health or drug plan to pay for your prescription drugs instead of paying the pharmacy. If you want to participate in or need more information about the Medicare prescription payment plan, call your health or drug plan or visit your plan's website. You can also visit medicare.gov/prescription-payment-plan for more information on how this payment option works. This payment option might help you manage your monthly expenses, but it doesn't save you money or lower your drug costs. If you need help paying for your prescription drugs or other health costs, there are programs that might be able to help. Many people qualify for cost savings and don't even realize it. Visit medicare.gov/basics/costs/help for information about cost savings programs. This product was produced at U.S. taxpayer expense.
Okay. So that is embedded in the presentation, and when these slides come out to you, you'll be able to see that again. I did want to go a little bit into some of those cost savings plans. However, before we do that, I did want to briefly talk about next year, 2026, as kind of a forecast here. These are the drugs that are being negotiated. Okay, so Eliquis, Jardiance, Xarelto, Januvia, Farxiga, Entresto, Enbrel, Imbruvica, Stelara, Fiasp, and then a variety of those, and then Novolog in different ones. Now, if you don't know these drugs, be happy, because these are some really, really expensive drugs. And so this is in the first tier. They will name 15 drugs, I believe, in the following year and 15 drugs in the following year. Now, legislation can always change this. It's important to know, but we do think that this is going to really help people. So stay tuned for more. Just a little bit about those cost savings plan. I really strongly encourage you to look into these plans. The income guidelines are based on your annual income. So many of you may not qualify, but many people do. And there's two separate ways that you will find out if you qualify. One is you will get something in the mail from Social Security, and they will send you a letter that says you are eligible for a low-income subsidy. Some people that are automatically eligible are those who are on Medicare and full Medicaid. People are on Medicare and Social Security, supplemental security income, or SSI. And then folks who are in a Medicare and Medicare and the Medicare Savings Plan, which is a state plan we'll talk about in a little bit. So you need to do an application, so you can automatically be eligible by Social Security. That's deemed eligible, or you can apply. And there are so many people, just hundreds of thousands of people, that do not sign up for these, even though they're eligible. And you can apply based on your income, your resources, and your family size. So please do consider it. There are some changes with people that are what's called dual eligible. So they are on Medicare and Medicaid. It is right now in 2024 that they can change their drug plans more frequently, and they can change up to once per quarter. And that's actually going to change in the coming year, and they will be able to change up to monthly. And so if you have a new medication that is assigned to you, you could change up to monthly if you wanted to. This is complex. However, remember, we have our SHIP counselors available at all times for this. Also, with the monthly special enrollment period, or SEP, you can leave a Medicare Advantage plan with a prescription drug benefit and return to Part A and a standalone drug plan, Part A and Part B, and a standalone plan. Okay, you can do that, but you cannot use it to change to a different Medicare Advantage plan. So I don't know why that rule is put on, but there is that caveat. Just to give you an idea of the costs or the income thresholds, and remember, this doesn't take into consideration your assets. Well, it does look like it's taking into consideration your assets. My apologies. So it's $1,800 a month for a single individual, or $22,590. Or for people who are married, it's $2,555 and $30,000. And I would want you to really talk to a SHIP counselor about the resources, because some will be considered and some will not. There's many plans that are $0 premiums and $0 deductibles. And then, as stated earlier, there's also caps on the different drug, generic or non-generic. Finally, we have the Medicare Savings Program. This is the state Medicaid program. You have to have Part A to be eligible for the Medicare Savings Program in Illinois. The benefits for this are based on your income, the resources of the individual or the couple, as deemed by the state. And you need to apply for the Medicare Savings Plan annually. So if you were eligible for this last year, definitely make sure that you reapply this year. Everything is renewed annually. And so you need to make sure that that is on your list of things to do. And it will save you money on your premium, your deductibles, and your co-insurance. So really, I was going to show you some drug plans. I'm not sure that we have time for that. I'm happy to pull up some resources. Medicare has really tried to revamp their site. You will go onto medicare.gov, and they have a big sign in the middle that says open enrollment. Do you want help? It will ask you what you need assistance with, and that's how you can navigate through the Part D plans. It is quite, let me see if I'm going to just show it to you after. I'll pull it up after Victoria talks. She's got a few more slides. I also put the link to the Medicare payment plan video if you have any questions or you want to share it. And then also for guidance and assistance from the Senior Health Insurance Program counselors, you can email aging. They will book out an appointment for you, or you can call. We have some sites in the city that you can go to, and many people will provide remote assistance for you. So Victoria, do you want to go ahead and take the next few slides?
Sure. Before I do, and I just wanted to let you know, we do have a question, and if you can reconfirm with the payment plans, those payment plans are not means tested at all, right? There's no income eligibility. Somebody who's can just say, I want this, right? And they get it. They don't,
Correct.
and so it's a good tool for somebody to use to spread out their payments. Good. Thank you.
Absolutely. Absolutely. Very important. I do see, I'll scroll through while you're talking. Victoria,
Okay.
if it makes sense, I'll scroll through some of the other questions.
All right.
I need to
Yeah.
continue sharing, so let me
All
go.
right. Can I have the next slide?
Uh,
Okay. Are we done with the slides? Because
Yep,
that's
we're
okay if
done with
we are.
this one. There you go.
Great. All right. So now we want to talk a little bit about how do you access SHIP and what a SHIP counselor could do for you. We've mentioned it a little bit, but to begin with, the SHIP program is free. And the best way to get in touch with a SHIP counselor is through our information and assistance line. Information and assistance is often our front door to getting resources for anything with our programming. Okay, so in addition to doing SHIP and signing you up to get a counselor, we also can help you with the benefits access application. And if you're not familiar with that, it's to get the license plate discounts. And if you're signing up for any of the free bus passes or reduced fares with the bus, that's you can do that through the information and assistance line. And then we also have our SHIP counselors. Next. So um, another way you can access is by calling us directly. So 312-744-4016 is a very convenient way to access information and assistance. Uh, there have been times where we get high volume. Let's face it, and it's a little frustrating at those times. You can also go to the uh, application Chai 311 and put in a service request there. So if you haven't used it before, it's Chai 3 CHI 311 app, and it'll come up and you can just do it yourself if you feel like it. And the other things we do with information and assistance is if somebody tells us what a problem they're having would be, then our information and assistance counselors can suggest programs because we don't expect you to know all the programs that the city offers or what are some of the things available through other community agencies. So if there was a particular need, like you say, I'm caring for my family member who has Alzheimer's, what programs are there for me? That's fine too. And then you can also request services like the home health aides to come to the house, and we'll put in those referrals to the state. But with the information and assistance, that's usually the best way to get started with the SHIP program. So if you're interested in scheduling an appointment, call 311, ask for senior services, or call the phone number directly or the Chai app. Some people like to email still, and so you can also go to aging at cityofchicago.org and express your need. I'd like a SHIP counselor appointment. Next, please. Some people also like to do the walk-ins for getting the information and assistance person directly, and we're in room 100 at City Hall. But I usually like to at least set up an appointment if possible by sending an email. Um, you have your variety. So what is SHIP? And SHIP is a volunteer program that is designed to help people navigate through Medicare and Medicaid issues. And the volunteers are very well trained, and it's a strong training program. And I do encourage you to think about having at least one SHIP volunteer from each village so that you have your own SHIP volunteer to help with appointments and things like that. If you're able to do a team, even better. But with the SHIP training, um, the volunteers are told all about Medicare, go into much detail about how to utilize the computer programs that will pick up all of the options for what insurance plans are in your area for Medigap, as well as for the Part D programs. So it's nice that you can tell somebody what your price limit would be, and you can ask questions. And then the SHIP counselor will help guide you through it because it can be overwhelming, especially if you're not doing this on a regular basis. About once a year, I do take advantage of the Medicare um, assistance from ship counselors or from Medicare.gov, depending on how close I'm cutting it and if I've made an appointment or not. Not for myself, but for my stepfather who I'm caring for. And it's managed to save me a whole lot of money, particularly going to the prescription drug part, because he's on Eliquis, which was one of those drugs that Karen said was going to be negotiated. But in the past, it was so expensive. If he liked his drug plan, and then all of a sudden they come up with a new schedule of drugs each January, what drugs they're going to cover and what they're not going to cover. And so sometimes it was on that schedule, sometimes it was off that schedule. So it paid to revisit each year and have the ship counselor help me to see if the drugs that we needed were on the schedule for that plan, and if they weren't, which ones could we move to that would also cover the time that we needed? So the small investment in time really saved a lot of money. And even with this cutoff on $2,000 for next year that you're going to be paying, it is helpful to be able to know that you're not going to hit it too early on in the year. You know, I I like to think that I'm spreading my um, budget for prescriptions out a little further. I know I'm going to have to get at least 2,000 paid next year, but I feel better if it goes all the way until August or something. Uh, and that's up to you to look at it. But the same thing goes with your Medigap policy. And you might have a situation where somebody is, let's say, thinking about switching the Medigap. Um, and remember, when they talk about the Part A, Part B of Medicare, those are the big sections, but it's sometimes confusing because Medigap talks about Plan A, Plan B, and it sounds so similar to a lot of us. And when you are looking at your Medicare and You 2025, I like to always go to page 76, which is the table of what are those Medigap plans, because then I have a nice visual and can look for myself as to what plan are they talking about for Medigap. But if you have a particular plan and you're not sure if it's the best one for you, you can talk to your ship counselor and you can say, you know what? Previously, I didn't really need to worry about home and community care, but now I need that service. Is it worthwhile for me to switch over from the plan I was using to the other plan that does include home and community based? And they might say, No, it's not in your best interest. Or they may say, oh, yes. And have you considered all these other ones and what's in your service area? So that's the reason why people would use CHIP, to help them when they're first signing up, to help them if they're adding a new service that they didn't have before. Like if you had a work related prescription plan and that qualified, and now you're no longer working, so you need to add a new prescription plan. Or if you're thinking of moving from Medicare Part A and B over to Medicare Part C, the Advantage, it's a good idea to check that out first with the ship counselor. It could save you a lot of money. Um, so that's the main stuff. Let's go
Victoria,
to questions. Go ahead.
I'd just like to add a comment here, if I may, is this is a very exciting time of year also for people who sell insurance policies.
Hmm.
And they will oftentimes um, hold sessions out in the community. They'll offer you free lunch. They will contact your organization and perhaps offer to give a talk to your members. And they will say, if you have any questions, contact our helpline and we'll help you. And while some of these people may be truly interested in only providing education, in general, what we have seen is that they are directly going to connect people to the policies that they sell, and or they may offer only information about the policies that they sell. And so it's really, really important that you get a unbiased person
Third party.
to
Yep.
talk with you about your individual situation and your individual plan. I can't stress that enough. I'm sure many of us are familiar with Oak Street Health, which is a Medicare HMO. They have a storefront throughout the Chicago area. They've grown exponentially. They are now affiliated with AARP and CVS. They had a $60 million fine leveraged on them or levied on them by the Department of Justice for soliciting beneficiaries, calling them, and then getting their interest in their program, and then directly connecting them to insurance agents who sold their policies. So they were providing quote unquote information, but they were also making money off you. And so I really want to strongly encourage people to make sure that you're getting your information from an unbiased person. It's crucial.
Right. We do have a question here about changing Part D plans if
Yeah.
your medication's not on the schedule of drugs coming up. And um, this is the time to change the plan. So that's why you check now. And they will publish the information early on what is being changed so that you do have this open enrollment time to say, oh, okay, I will have a change coming in January. Let me go during open enrollment, change my plan so that come January, my medicine that I need is covered. Okay.
I did think, Victoria, if it made sense, I would just show people the Medicare Plan Finder
Go ahead.
that they could go to. I'll do this in the background while you continue answering questions, if that makes sense.
Okay.
Everybody see my screen here? Can you see my screen with the catastrophic coverage on it?
Yes.
Okay, so,
The font is very small, though. Is there a way you could increase the font size?
sure, I'm good at that. This is my normal font size. That was Medicare. Now, what I want to show you also is people, I just Googled Medicare Plan Finder, right? And just note that some of the people who first pop up are going to be not just Medicare.gov, but you say, oh, here's a Medicare Plan Finder. And it is, you could click on this and they sell drugs. They're going to connect you directly. So I'm just really want to stress, be careful. So if you go to Medicare.gov to Medicare and see, welcome to Medicare, get started. It's open enrollment right there on the left where my cursor is. Find plans. Okay, and then it will load and it will tell you. Now, if you have a login, it already has your account set up. So this is helpful for folks as you're looking like from year to year. So it will tell you your current coverage and your pharmacies that you use. But you can see if you were doing something for this year, you could look at 2024, but you could look for 2025. Let's see, let's do. They will ask you what type of plan you want. So again, remember, if you get Part C, you cannot get a Medigap policy. But if you get Part D, you could get a Medigap policy. But not if you have a Medicaid Advantage plan. So there was a gentleman who was asking about Part F. I made a comment about it. I pulled that up from a Medicare book that I have with me. But you could look directly in here to see your Medigap policies. But let's say you wanted to look for a drug plan in the 60610 zip code. They will ask you, do you already get help? Do you have any of these resources? And you might check, no, I don't get any help with this, continue. Do you want to see your drug costs? Yes. And then it actually, this is where somebody asked the question like, what drugs do you take? Or how do I know what plan to take? Let's say
Mhm.
just choose a smattering of drugs that someone might take. And let's see, we're on psychotropic. Take a Pax, this isn't Paxil, this is a different antidepressant. And let's say you are on Norvastatin. Let's say it's Norvastatin, one's usually less expensive. And you add it by dosage, you really pull all of these things up. And let's say you're losing your mind from the election. So maybe you're taking some Xanax also to help you deal with everything. And it's going to say, oh, there's a more generic version. Take that. Do you want that added? Yes, add the generic. Okay. So if I have these drugs, let's say I'm done adding these drugs, and you can choose 5 pharmacies and they already have a zip code for me. You can choose how far you would like to go. And then when you compare, let's say you're going to compare CVS to Walgreens to a mail order pharmacy, and you can choose up to 5 to Jewel and then a specialty pharmacy. Okay. And then what it does, and I know I'm moving fast here, but if you come see a SHIP counselor or have a call with them, they will do this with you on the phone or in person, however you would like. So they will tell you that this is one plan. WellCare, they have the star rating. So people rate their plans. Here's Cigna. Okay, here's your monthly premium. Remember, you'll have a premium for some. This is what your total drug cost will be for retail versus mail order, and then what the deductible will be. And it says that 3 of your 4 pharmacies are in network. In network is usually closer. You can even enroll here. Now, keep in mind, you can also visit with a SHIP counselor and do your enrollment while you're on the phone with them or while you are with them in person also. So here's Humana. You can see it's it's very low monthly cost, but the higher drug cost. So the tool online is a good tool. So I would encourage you to use that. It is listed in the slides. Victoria, was there anything else in here you wanted me to point to?
No, not so much in there. I like the fact that you don't always have to commit by setting up an account, that you can browse it and just see for your area, your zip code, what works. And then you can go back if you find that the information they're giving you is something you do want to make a change. You could then make an account and go ahead and make your changes online if that's what you choose to, sign up there. When it comes to some of the like Medigap programs, if somebody uses this tool to search for Medigap, it's good to see which Medigap plans are based on like age and which Medigap plans are more like everybody's in the same group pool, because their price may differ. For example, if somebody's going into the Medigap plan when they are 90, that they didn't need to have Medigap beforehand, they were really healthy and they didn't want to do it. Because of their age, they may find the cost of the cost of the premium too high for them with all the ones that focus on what your age is, but they may find it's more reasonable if they go into one of the Medigap plans that pools all ages, and that might be better for the 90-year-old just choosing to enter uh, and Medigap now. So it's good for exploring that on this line. We did have a question about um, the Advantage plans.
Okay.
And
Victoria, before you go there, can I just point something out
Mhm.
here? Is that you can also see the monthly drug cost, and you'll see the out of network. This is with this is the preferred network. These are $5. Out of network, almost 500. And then with a mail order pharmacy, you'll say, oh, it's $15. That's because they give you 3 months at a time. So, sorry, just wanted to show
no,
that.
that's important because it's the 3 months and it's the same price. So
Right,
somebody
right.
might not go for mail order, which is so convenient, right? Because it looked like it was a higher price.
Right, right. So, okay.
But with the Advantage programs, if you're in an Advantage program and for some reason they stop offering their drug plan, or maybe the whole plan ended because occasionally they go out of business,
Yep.
you are given a window to reapply. So yes, open enrollment is when they want you to do it, but if there's a qualifying event, like the plan was no longer offered or they stopped even having Advantage, then you can uh, enroll. So think about that. There's also a special enrollment period for Part C Advantage, which is coming up in the beginning of 2025. So do you have the dates for that? And do you have
It's
the dates for the next volunteer training program if people want to become SHIP counselors?
the next training is not until May. Actually, they wait
Okay.
until all of the open enrollment periods are done. I did reach out to the state. This is a statewide program. And there are some special attributes of SHIP volunteers. They are remarkable folks. They are interested in continuing to learn. They are interested in helping others and communicating plans to people. They can sit and look at something with someone and investigate on their own sometimes if needed. And what we found also is while it's busy during open enrollment, there actually can be needs for SHIP counseling throughout the year. Really, it's a wonderful program. I would suggest that every village should have 1 or 2 volunteers trained. I usually do recommend that people have a colleague to do that work with. I'm also going to send you all this open enrollment checklist. I don't know if you can see me on camera, but it has questions you want to ask yourself. What's your current plan? Do you have any concerns with your current plan or any health considerations you need to move up with? Do you have Medicare Advantage? And if you have Medicare Advantage, every letter you should get, usually before September 30th, is the annual notice of change, which is what they have to tell you when changes are coming up in your plan. And then you would also want to find out, an annual notice of change could also be sent to you by your Medicare drug plan. And so that is one of the changes. If you have changes happening in your Part C plan, you should receive an annual notice of change. So I don't know if any of our SHIP counselors on the call have any other guidance that they could provide. Or anything they'd like to add, Lori?
Oh, you have to unmute.
There you go.
What I'm doing. Yeah, a couple of things that you might want to do. You can do the Medicare Part D from the plan finder yourself. It's fairly self-explanatory if you work through it. If you can't, You can get a SHIP counselor to help you. If you get a SHIP counselor, I urge you to, if you set up an appointment with a SHIP counselor, you need to have your Medicare number, you need to have your drug list. And if you've ever gone on Medicare.gov and you've signed in, please keep your password forever, because it's set up so that if you don't have your password, it's a real hassle to retrieve it. It can be done, and it's done all the time, but it takes almost as long to get the password as it does to work out the plan. That would be one thing. The other thing that you talked about a little bit about the supplement plans, it's not as straightforward as it sounds. You can sign up for a supplement plan when you first go on Medicare, and they have to take you. Okay, then you look and it's the least expensive and so on. They do not have to take you afterwards. They don't have to change from D to N. They don't have to go from the United Healthcare to Blue Cross. You're kind of stuck. They have what they call Medicare medical underwriting, which means that if you have I don't know, if you've got an ingrown toenail, they decide you've got a medical problem. I'm being facetious there, but really, they don't have to take you, and they can make it very expensive. So if you're getting a Medicare supplement, kind of plan it in advance and stick with it, or plan that you probably are going to have to stick with it. A new thing with Medicare supplements for everybody that has them, in the last couple of years, some of the Medicare supplement plans have added extra benefits that they didn't do before. So call them and see what they've got. For example, mine, I have had the ARP United Healthcare, and I discovered last year that Lifeline or Lifetime Health Health Club in the building on Chicago and State, it's free. It comes with my supplement plan. How's that for something interesting? And I just discovered that accidentally, and I belong to that, and I go there, and I go to a lot of their classes, and I don't get charged for it. So check with your supplement plan if you have it, for sure. So those are kind of my little thingies for today. And go ahead and do that. But the other thing is, if you're going to the doctor and you're getting sometime in the next month or so, and you think you might get a new prescription, wait to look at the plan finder for Medicare Part D until you've gone to the doctor, because if you've got a new drug, it may change what you're doing. So there's no reason you can change it again up until was it December 7th? But you don't want to do that. So that would be something to keep in mind. So if you've got a doctor's appointment in the next month and you think you might get a new prescription, wait and do it after that. And I think that's everything.
That's great. Thank you so much, Lori. And a few of you have messaged me directly saying that you would like a SHIP counselor appointment. Some of you have provided email addresses. If you could provide email and a phone, or one or the other or both, that would be really helpful.
Yeah, I tend to do them online on Zoom or by phone, and it really honestly works better because I'm sitting here in my office and I've got all of my stuff and my own computer, instead of going downtown and saying, where is this piece of paper and why isn't it on my computer? And I generally find that working better, because sometimes I have to do research and then I have to call you back. I call Medicare .gov all the time and I say, I've got this weird problem, or I call the state for Medicaid stuff. So think about that. All right,
Yes.
enough.
Thank you, Lori. Thank you, Lori. That's wonderful. Just kind of all pro tip here. Whenever you have a conversation with Medicare, write down the number they give you. They record everything. And if they tell you something, you want to write it down. SHIP counselors have a special express line into Medicare, so they're able to get information much faster. So that's something else to let you know. Trying to think if there's anything else. Always write down the number they tell you. And just bring, like, as you said, Lori, bring all of your Medicare information. Any other papers you like folks to have handy, Lori?
Their Medicare number,
Mhm.
their drugs, including the dosage, frequency, whatever. But honestly, please keep your password. I can't say that enough. It is the biggest pain to retrieve it. Worse than almost any site I've ever run across.
And I will tell you, as a SHIP counselor, you will have people call you every year. How many people do you talk to once a year, Lori?
I looked actually through my 2023 list, not just open enrollment, but 39.
That's amazing.
I know. I'm trying to figure out how I
Just
ever got that done.
That's-
But yeah, people do call me back, and that's fine. You also, one more, I'm probably taking more of your time than you need, but when you want to make an appointment with a SHIP counselor, if all you want to do is look at Medicare, at the Medicare Part D plan, please tell somebody. That's a very easy and very quick thing. If you've got something more complicated, they're going to allocate a lot more time for you.
Great, thank you.
Okay.
Excellent. And I see you have a testimony in that Sherry London said she's had assistance from you in the past online, and it's been fabulous. How about that?
I'm almost afraid to say all these things. I'm going to duck or not answer my phone or my email. But seriously, I'm happy to help. And I assume, Karen, I don't know what your, who else you have and what other things that you have. You know, and people that, I know you have people on staff that do it too.
We do.
So that's just fine. And fortunately, I have found that people have been very nice, and if they have my email or my phone, I haven't had anybody take advantage. So that's
Yeah.
been very
Thank you.
okay. All right, I'm gonna mute. So I'm gonna mute so I don't talk anymore.
Me too.
Except it's not muting.
All right. So all of you are muted, and all we can say is thank you. You have actually villages all over the city. So Lori, you're in our neighborhood. We might even see you on the street. However, if you were on the Hyde Park or on the north side or on the west side, there are people from all of these neighborhoods. Anyway, we cannot thank you enough. This has been so informative. Victoria, Karen, really wonderful, wonderful. And on behalf of all of the villages of the Chicagoland Village Network, we thank you so much, and hopefully we'll make this an annual thing. I think that this is my tagline for this program always has been, don't fall in love with your Medicare D plan. Look at it every year, because I know that since Medicare D has come into effect, we've probably saved people over $100,000 with these kinds of programs, well over that. So again, thank you, thank you, thank you both. It was great to see you and great to see everybody.
Our pleasure. Thank you very much.
Absolutely a pleasure. If any of your villages would like a private program before open enrollment's over, we're happy to kind of do this again. We can have more of an explanation about Medicare too. We'll keep it under an hour. Just let us know.
Great.
Thank you. Thank you.
That's just terrific. Thank you. And thank you for making SHIP counselors accessible to us. We're really grateful. Thanks.
Okay.
Appreciate it.